study. We're going into the disorders. So these are things that you all are probably more accustomed to. So maybe that will help in the study plan and things of that nature.
I can see it now, Gilbert.
And so each week
I
going
even have
forward,
my little
we're
bar.
going to discuss a different system each week. Miss Gilbert's going to do some of the systems, and thus each week, and then I'll do some towards the end. So that is the plan. And as you all see, Miss Gilbert, do you want to go to the week 7 learning outcomes or any of them? Because for the most part, the learning outcomes are essentially the same. You want to discuss those first, and then we can go into your content.
So week 7, 8, 9, there's 4 weeks, 7, 8, 9, 10. Your learning outcomes are basically the same STEM and then the new system. So compare and contrast diagnostic tests used in the integument system, compare and contrast manifestations of the integument system, and then compare and contrast nursing interventions and treatment methods used in the integument system. So you'll see these same 3 for each system. There are some weeks that there's 2 or very similar systems that are put together. And then on occasion, there's this extra one that's required by the standards for QSIN. And so this is going to be incorporated into your learning assignment module for this module. Okay.
No, that one's going to be in there. We changed that one, remember?
No, this is the circumcision one. This one is still there.
Oh, I thought we put that in the.
Because that one is specific.
Okay.
The other one, we were letting them choose one, but we decided that was
no, for the paper
project. Yeah. That was the other one.
Okay.
So then learning 8, you see there's 2, so GI and GU, and so it's the same 3 that are repeated for gastrointestinal and then genitourinary. So it's just repeated throughout the same learning outcomes. Also, in the first week, week 7 is integument, and then week 8 is GIGU. I have gone through and pulled apart because, like Ms. Love said, it's becoming a little more specific on those topics. And so you have just 2 pages, 1, 2, like, so pulled out the very specific reading assignments, okay? Because it's kind of sporadic in the textbook, but it's a little more defined here. Here's your topics list for week 7. So these are all of the items that's going to be discussed this week. Pruritus gravidarum, ICP, PUP, breast skin breakdown, mastitis. So some of these we've already kind of discussed, but we're going to go more in detail on treatments and interventions. Diaper dermatitis, seborrheic dermatitis is not in there. Umbilical cord care, circumcision care, eczema, contact dermatitis, acne, warts, and burns. PUPs are pads. What? Mike said PUPs are pads. I don't know what that means. Sacral pads.
Pads on the bed. Maybe that's what he's.
Oh, no. PUP is, in this instance, acronym Pruritic Urticarial Papules and Plaques of Pregnancy.
Yeah, and PUPs are actually those things that go on the feet.
Yeah.
And the bony prominences. I think that's what he's referring to.
So yeah. So this is basically your topical outline. So it's giving you a list here instead of a topical outline later. Yeah, so when we go into the PowerPoint, it's always been read only. So what you have to do, you can go in, you can file and print when it loads. There we go. So you can file and print your slides. I've also, because it was so sporadic with me lecturing on these slides, on your slides have notes for the exact page numbers that I got them from, just FYI. So when you go through, and then on your video has been uploaded to YouTube, so it'll automatically play through. Line 2, but click on file.
That was a reference to Beverly.
Read only. Oh, yeah.
Response to Beverly.
So it's read only because you don't have editing privileges. But you can print them however you want to instead of me creating a PDF. And some people like it 2 per page, 1 per page, 5 per page. You can print it however you want to. Okay. And then, so for your Module 3 learning assignment is hyperlinked here. However, the full thing is not completed with the rubrics yet. So it's not opened, but we're going to go ahead and let you know about your first assignment for your learning assignment that deals with your integument disorders. So what you're going to do is establish and construct a teaching brochure or presentation for new parents on care for circumcision, breast care, umbilical cord, diaper, perineum, episiotomy, and sutures. So include 2 statements per item for care. So it could be PowerPoint slide presentation. It could be a formatted piece of paper that's like a little trifold piece of paper to give to new parents on discharge. There's so much information. They're not going to be able to remember all of these things, right? So having something on hand. So some of y'all were already putting up things like no alcohol, making sure you wipe front to back. You know, those are quick, easy 2 things. So circumcision care, making sure that it's cleaned, that depending on the type of Glomco or Plastibell, you use Vaseline or not. There's 2 already. Breasts, if you're breastfeeding, make sure you use some sort of cream or barrier, and you fully empty your breast. Report signs and symptoms of infection. Umbilical cord care, that you're folding the diaper down so it doesn't cause irritation. Like, just go through really quick, at least 2 points. You can do more. Just quick summary or quick major points for those new parents. You can choose to pair up in your group or perform it on your own. Just make sure that if you do pair up, put both of your participants' names on the document. Okay. Are there questions about that part of your learning assignment? So as soon as you are able to have the time to review the PowerPoint and the lecture, just grab a couple of things that was discussed and throw it onto a piece of paper or your own little summary PowerPoint to give education to new parents. Yeah, so yeah, whenever you start digging into it, let us know if you need any help. Just quick summary.
Is that the entire?
Sutures, as in the fixing the episiotomy sutures that would be sutured together. What? Sorry, TK.
Can I make a brochure and then record myself explaining it?
You can. All that's needed is the brochure, though. So if it's on the brochure, that could be fine.
Okay.
Just some sort of information to them. So it could be the document, it could be a PowerPoint, you could record yourself, whatever you think is best or easiest for you to run through. But in the scenario of new parents, so that they have a quick checklist to refer to. That is not the entire learning assignment, that is just the part 1 for Module 3 that is associated with the integument stuff. And then our hope is by this afternoon to have the rubrics finished for the rest of the modules learning assignments. So the rest will be up. But this will be your only potential to pair up group thing. The other ones will be on your own. Okay. So then for this module, your comprehensive project is going to be your problems part 1. So you're going to identify 2 health problems for each age group. So during this time that we're going through all of these problems, you pick 2 problems for newborn, 2 for infant, 2 for school age, adolescent, 2 maternal. So then you're going to have a total of 12 health problems. And you're going to provide education on those. Treatment, interventions, and education to the client or the family member for those 12 problems. So we're proud, like, look at all this. You could probably get this done by next week. So you don't, but keep in mind, so if you want to do ADHD, there might not be a lot other options for adolescent. So maybe use your ADHD in an adolescent or school age. Don't do an ADH for infant. Like, it has to make sense. Does that make sense? And choose your problems wisely so that you don't run out of problems for an age group. Right? So you don't have to do it over all the problems. You don't have to summarize everything that's going on. Just pick 2 for each stage. Does that make sense? Okay. So just pick 2, what it is, treatments, interventions, and education. Okay. You have to identify it, treat it, and give education.
So any problem for each age group, like not necessarily.
Any problems that's discussed during this module time. So over the next 4 weeks.
Okay, so
anything from this
in that
list,
okay.
or next week for GIGU, you have this list. So just apply it to one of those age groups.
Okay.
Some
Gotcha.
of them are going to be more specific, like the hydrocele are going to be infants or toddlers. So some of them are going to be more specific anyways. Cryptocortism, you're only going to see those in younger children. Intussusception, same thing, younger children. So, but then don't use that on an adolescent, you know what I mean? And then run out of toddler problems. Does that make sense? So kind of go through and plan all of your problems before you start writing on something and then have to change it later. That's my concern for you guys, that you're just going to start typing and then you'll have to change it to a toddler and then still need something for infant. And then, so make your plan before you start writing. But there's going to be plenty of problems talked about. You can just pick any 2 for the stages. So you have only 12 to talk about. Okay. Yeah, 12. So 2 for newborn, 2 infant, 2 school age, 2 adolescent, and 2 maternal. So you have a total of 12 problems. Any other initial questions? Really? 2, 4, 6, 8, 10. Haha. How did I count 12? Let me go to the original document. 2, 4, 6, 8, 10. Yep, I just miscounted and put 12 again. So it's only 10 then. I'll update the rubric. Not in student view though. Good catch, guys.
Miss Gilbert,
Mm-hmm.
we don't do toddler.
Maybe that's where I got.
You said toddler, and that's how you got 12, but then on the screen, there's no toddler listed. So I'm just making sure we don't have to do toddler.
Maybe that's why I had 12. Yeah, you should do toddler. So
Okay.
thank you.
You're welcome.
2 for toddler.
Thanks a lot, Meredith. You just gave us more work.
And toddler is after infant. I knew something was weird. But it was on the original document that way too. So typos. I'm gonna fix it again. Problems, education part 1. Oops, not that part. So it's the same thing. All right. So if you miss one of those and you don't have your 2 for each, total of 12, then you would get the partial credit there. And where did my points go?
Miss Gilbert,
Mm-hmm.
I was looking on the module 3, like weekly assignments. Is week 9 maybe not open or something?
Not right now. Miss Love has it closed. She's working
Okay.
on it.
Gotcha. Okay.
Yeah, it's hidden. But 7 and 8 are there. 10 is also being worked on, but she doesn't have it hidden yet.
Okay.
It'll be updated, but
I was just trying to make a list of all the topics that we could.
yeah, so week
Yeah.
9 is going to be musculoskeletal and neuromuscular problems.
They'll be open soon. I'm just trying to make sure that I've got everything there that I want to have there, and that I'm trying to alleviate having to go back and like make corrections and all of that
Update.
stuff.
Yeah.
Yeah.
So like how I have everything here and set up for you guys for next week, but I don't have these PowerPoints done. It's just the link, like legit. This is what I'm doing today. Blank, 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 blank.
Yeah, I'm
You
not
can't do
that
next week
dedicated.
yet.
I'm not going to put all those page numbers in multiple page locations. She is much more dedicated than I am. I'm not going through that, that's
I
a
went and
lot more.
found everything in all the places.
Nah, I'll put them where they need to be, and yeah,
But
I'm not
the
that dedicated.
PowerPoints, there's nothing there and the video is not there. So you can't do that part yet, but I've given you all the resources and what we're doing next week. Yes, I know. I tried to refrain from doing that for the content portions, but it's really pretty for the beginning ones. So these ones are still black. All right. Any questions?
Miss Gilbert, can I say something while there's a space here? No one has questions apparently. um, I hope I don't get in trouble for this, but I don't really care. So you all were stressing about the GT PAL. I'm reviewing the exam right now, and of course we're going to release results later on and all of that. But just right now, 90% got that GT PAL correct. So I want to congratulate you all on that because I know you all were stressing about that.
I haven't even looked at the results
Yeah, I printed them. So we'll discuss the results later and all of that stuff, and you all will get your results later on. But that's just one that I saw, and I know that was a source of contention for you. So we'll well, we've got to review it first. So no, we're not going to talk about any grades at all, period, because we've got to review the questions and all of that. But I was just saying on that specific question, because that was a source of contention, I do know that, regarding the GT PAL. So that one, it says 90% got it correct. And I don't know who didn't. I just have that one numerical fact. So
We could have had a
congratulations on that.
calendar on there for the due date so we can know how many days it was in a month.
For what now?
On the due date one, the last menstrual period, I think we were caught up on, did the days of the month matter? Like, I think that's what Marita was asking.
Oh, no, it's just weeks.
Oh, yeah. Yeah. So we were just asking what the percentage of right was
Because
that question.
when we were
okay.
calculating it in the live scenarios, we talked about how like April has 30 days and July has 31 days. So if
Y'all
you're
haven't
going
ever done
over
the
the next
done the
month
knuckle
and
trick?
you're adding 7, then yeah.
Whoever was proctoring mine was probably like, "What the heck is he doing on his knuckle?"
Oh yeah.
Yeah, isn't it just 7? Okay, anyway, it's done. I don't want to get into that because I may say something that's
But it's
confusing.
that 7 goes
But I
over
just,
your month. Yeah.
okay. Sorry to interrupt your program. No, I'm not. Great work.
When you remember to use it.
Miss Love said, sorry, not sorry.
That's not what she said. Yes, there's no special things. It's just your stuff. All right. Well, I have placed calendar appointments, and so has Miss Love for the next few days, in the afternoons, and then I have morning of Friday. So just indicate the reason that you are setting the appointment, if it's for remediation or questions about the project, questions about learning assignment, whatever it is, the reason that you're signing up for, just so we can be prepared for it. Also, if we have appointments, like I have it from like 1 to 3:30, so every 30 minutes. If it's 2 o'clock or 2:15 and you sign up for 2:30, you're gonna stress me out. Because I don't know what it's about. I don't know what we're getting into, and you're trying to meet me in 10 minutes. That would probably be better to have emailed beforehand and ask, hey, can we meet real quick? Just to make sure I haven't already allotted that time, because no one signed up for the appointment. So I'm gonna go to this meeting or do something in Canvas, and then I'm in the middle of something and have to stop. It's just a little courteous. Shoot me an email. Hey, a minute. If it's like right now, if you're setting an appointment for later this afternoon or tomorrow, then that's fine. But if it's in like 10 minutes, shoot me an email before you sign up for it.
Or even an hour. Like if you know, like they need to be an hour ahead because we do make plans and things like that. And if there's nothing scheduled, then we can make our, go fulfill our plans.
Yeah, and it's unrealistic to just sit at the computer from 1 to 3:30 every day, just waiting on appointments. So yeah, we're doing other things in the background, waiting on appointments. But if you haven't pre-signed up, please shoot us an email first.
Also, to clarify, so that you all can make your appointments, what we're going to do instead of in addition to. So our focus today will be to review the exam so that you can get your grades and set up your remediation appointments. And then we'll continue to work on the content for this module, because you have plenty of work to do right now that will, fulfill the rest of this week. So I know for scheduling purposes, but we'll get that done. But what we need to focus on first is to get the exam reviewed so that you all can make your appointments and get those done.
Plan your week.
Mm-hmm.
Miss Love, Miss Gilbert,
Yes.
are we going to have remediation due for this exam, or is that yet to be determined?
Yeah, so anyone who scores less than a 70% will be required to do remediation. So after exam 2, you have your exam remediation. There's nothing in here right now. This will be a quiz based off of the top missed items when we review the exam. So when your exam is posted, your grades, this will be ready as well. So then what you have to do is review your topics that you've missed, so that you can perform better on this quiz. But then you're just going to do this however many questions quiz it is, and hopefully show improvement, that you improved on those items that you missed on the exam. So they're going to be similar questions. And that's going to be the same thing for everyone, for every exam, but it's only for less than 70 are required, and you have to meet with an instructor less than 80. Then it's recommended that you do this remediation quiz and meet with us, but it's not required.
But just like normal, everybody's required to do this quiz.
No, only less than 70.
Oh, sorry. Okay, sorry.
Not everyone has to do remediation in this class.
But anyone is welcome, right? Or to remediate, to meet with us to remediate.
Mm-hmm.
You're welcome to do that as well.
Mm-hmm. Sign up for appointments.
One thing I would encourage you all to do, just as in the past, start with your A&P. Start with the A&P, especially because now we're going to be talking about different physical, for the most part, but also mental conditions. Start with your A&P. Do the A&P review. So, integument seems simple, and for the most part it should be, but you still need to review your A&P. So with each section going forward, start with your A&P. Think about the things that could go wrong. Think about how whatever the system is, think about how it's supposed to work. And then think about how it could go wrong. So for the skin, not to take over the lecture, but just as an example, we know the skin does multiple things. It provides a barrier, prevents fluids from escaping. It provides infection prevention. There's so many things that it does. So think about what happens when the skin doesn't meet those normal functioning criteria. What would that look like? And then what would the person experience? So think about those things. And then, Ms. Gilbert and I will, we try to provide as many resources to help you to visualize, to visualize the conditions, things of that nature. But as you're trying to study, try not to just read through for the purpose of reading, if that makes sense. As in, just because, okay, so I have to read XYZ, these chapters, so I'm just reading it to be reading it. That doesn't help you. Read with a purpose. So as you're reading, think about, as you're learning about the condition, so warts. What are the nursing implications for someone who has warts? Well, first of all, what are they? And then what problems do they cause? How would I know that the person had those? Again, those ATI templates can be really helpful in your preparation for the exam. So when you're reading, when you begin studying, start with the end in mind, if that makes sense. The end is going to be the examination. Start from the beginning, as in, you know now that your exam questions, for the most part, are application. So start with that. Start when you're reading about warts and eczema and all of these different conditions. Think about it from the nursing perspective, because just knowing the A&P or the pathophys is not what your questions are going to be focused on. So that's my suggestion. And then again, once you've done those things, test yourself. Find some questions. There's questions everywhere, but you all have your EAQs. You've got even the Elsevier provides some questions, and you certainly have ATI, which has excellent questions. So use those things as resources to help you prepare for your exam. Another thing is, like here, we're focusing on the weeks, but even within there, you see you've got all of these. Can you, just because of the feedback? I'm trying to scroll up as though I have control of the screen, sorry. But you see all these different conditions. Um, again, look at those conditions from the perspective of nursing, as in, again, what are the risk factors? Who's at risk for it? How do you know they have it? What's actually going on? What are the diagnostics? Think as you are learning that, think it from that perspective, and then test yourself to see if you can answer questions on those. That is one of the, not the only, but one of the best ways that you can prepare for your exams.
Excuse me, Miss Gilbert, I have a question. I'm sorry, this pertaining to the exam. I just wanted to put this out here for you guys. On that exam, it had list the in order in the first and second and third trimester. I just wanted to let you know. I don't know if it, but it had the without the menstrual cycle and the good air signs, the quickening and the lightning. And just to be on the safe side, when we did the lecture and we did your first, second, and third trimester, the quickening was in the second trimester, but it was on the in ATI, it was like a presumptive sign. So I'm thinking it in ATI it would have went before good L signs, but the way we would when you lecture us, the quickening came after the good L signs. If you understand where I'm coming from.
I'm assuming that was from Ms. Gilbert. So we'll look at it. So question is regarding Goodell's versus, what was that?
Shouldn't it have been the Goodell's quickening and the
Okay. Okay. We'll look at the question.
Yes, that's what it should have been, but actually, honestly, that's the way Miss Gilbert taught us. But if you was looking in ATI, quickening actually come before the good L sign, because quickening is a presumptive sign.
Okay. So we'll look at that one.
Okay.
And just like and I feel 100% that Miss Gilbert agrees. If you all find things, um, again, just like this situation, like we said last night, we will, if you've got something to support it, we'll give you credit. We're not trying to withhold points. I never, these are your points, not mine. So we're not trying to withhold points. So if you can find, something like that, that's fine. You know, for me, and I know for Miss Gilbert, our goal is that you all learn the material and that you have the material such that you can pass your NCLEX. So we'll look for it. And we actually look at each of the questions. As a matter of fact, we actually do. We review the questions, we review the options before and after. Um, so yeah. That's why we don't release the exam immediately, because we'll get all kinds of emails and phone calls and things that we can avoid by checking before we release, or at least try to. So that's definitely on the list. That's something that we'll look at. Ms. Gilbert, do you have anything on integument? Because I sort of jumped in.
No, I was typing, so I muted myself,
Okay.
so it wasn't super loud.
Okay.
But yeah, I think I'm okay setting up this. So yeah, if y'all have questions, just let me know. But all of these are in this PowerPoint lecture. Okay. I'll look at it, Miranda.
All right. I keep trying to scroll your page.
Which way?
Are there any questions about the F.A. Davis interactive case studies? Because I think you all have done some, but does anyone have questions about how to access or complete those?
I don't think they've actually done them yet. I think we
Have
have
they done any? Okay.
shown them one. But I have them linked.
Okay. Because you will have those going forward. That's why I want to make sure that so you want to look at one and discuss it? I think that'll be a good use of the time to prepare them, because you will have several of those for your upcoming assignments.
So it should bring you straight into the scenario. You shouldn't have to sign in. If it asks you to sign in, you can create a free account, and you don't need to use any special email or address or anything, access code. When you're done, it's going to ask you for your email address to send you a report. So what essentially is you're going through a care plan. So you're going to get a scenario, an overview. You're going to read all of your information, but they're going to bring these things back up. So don't feel like you need to copy paste this or print it out on each thing. They're going to review these things with you. So this is, so next is going to tell you how to do it, going through your assessment, diagnostics, clustering. So assigning what to what kind of category. I'll show you in a second. Assigning your diagnoses, your goals, your interventions, and your outcomes. So on your interview questions, so what interview questions would be relevant to your scenario that is going on? So if it's not relevant, don't select it. So I'm going to do whatever. Oh, it tells me that I've got some that are incorrect, and I only have 2 attempts left. So here we go. And then it's going to give me my feedback. All right. So it asks you if it's irrelevant or if it's relevant. You only want to select the ones that were relevant as you're going through. And then, so now you're going to go through your assessment: inspection, palpation, auscultation, and percussion. And again, only do what's pertinent to what's going on. So it might need a full head to toe assessment based on what's going on. It might need a focus assessment. So only do what's applicable. So then you click whatever is applicable. Is it really necessary? I don't know. I didn't catch his age. But again, I'm just skipping through. Tells me what I should have clicked: relevant, irrelevant. Continuing. So now we're on our lab and diagnostics. So I'm just going to choose one. So I'm getting these all, of course, incorrect. So you're actually seeing the answers, so you can do it later. So now we're clustering. So this information, this assessment data that we've collected during our interview and assessment, Now I'm going to cluster and figure out, so this is telling me that I have 3 categories. So I'm going to determine and drag these into 3 categories. So it might be all of these are psychosocial, all of these are reproductive, all of these are something. They're all going to be 3 different categories, and you just put them all in there.
Are the categories like predefined, or is it just something that you're kind of doing mentally as you go?
Mentally on this step, when you get to the next step, it's going to give you your clustered diagnoses, and you're going to put them at the top. So you're trying to do it not in a backwards way, but in a critical thinking way. So you're reviewing all the data and clustering it, and then you're applying your data to a relevant diagnosis. So now I've put my diagnoses in, which are of course incorrect because I'm just going through it. And then it'll tell me. And then now with my goal, with my diagnoses, I'm going to set my outcome, my goal. So what do I want this goal to be? Is this applicable to this diagnosis, all 3 of them? It could be 1, however many. You're assigning it to what goal. And then same thing for your interventions. Is this intervention appropriate for this goal, this goal, this goal, both goals? Just read it and see which one it applies to. You're gonna not do it incorrectly all 3 times, but here we go. And then your outcomes. So this is what it's just gonna show you. And then you're gonna view your results, and I did horribly. So what directions it says is that you need to have an 80% in each one of these areas. So you need 80% in each criteria here. NA, of course, is NA. You put your name, you go to print, but you're not going to print, you're going to do PDF and save it to your computer. And then upload it. I'm not going to upload that, save that because it's horrible. It says email instructions, results to your instructor. Don't do that, please. I don't want a 50-minute random emails and then not uploaded into, it just needs to be all in a nice little pretty package and Canvas for me to create, please. So don't do that. And that's my personal email. You shouldn't see that.
So regarding these assignments, you can see that you can, and I'm just going to be honest, you all can see that you can just click through and just keep clicking through until you get the right answers and submit it. But what I would encourage you is that
because then you're trying to memorize it and you're not learning.
If you use these with the perspective that I was mentioning before, because these can be really helpful in preparation for your exam. And one of the beauties of this type of assignment is that it helps you to develop the clinical reasoning, clinical judgment, and critical thinking that you need in the care of your clients. It also emphasizes the nursing process, so in this program, you all don't do nursing care plans per se, but nursing care plans are just an implementation of the nursing process. And NCLEX is all about the nursing process, even though it's worded differently. You all may see clinical judgment, clinical reasoning, but the focus is that we use that nursing process in using our clinical judgment. Okay, so what this does is it helps you from the application perspective, because again, that's what NCLEX is going to ask you for the most part. Now, of course, there'll be some knowledge questions, and there may be some, do you recognize the A&P and do you recognize the pathophys? But for the most part, it's application. And what these scenarios do is to help you to build those application muscles. So I would encourage you to make make this a purposeful assignment and not, perceive it as busy work, because while they can be a little bit time consuming, they really should not, right? It shouldn't take, 2 or 3 hours to do these at all.
Mhm.
But if you use the content as is, um, I think you will find that they can be very helpful. And as you read, you know, again, if you look at it from the perspective of let me just rush through this assignment to get it done, then you'll miss a lot of jewels and gems within the assignments because as you see in the feedback, it gives you so much information.
Rationale
And
as you're going through it.
and to speak to what Mike mentioned, Mike and someone else, you were talking about you're tired of the most correct questions. The thing is, you never know what you're going to be questioned on, right? We try to narrow it a little bit, but even in our narrowing the information, we have no idea what NCLEX can ask you. And NCLEX, I promise you, is going to ask you to identify the best answer. It's always going to look for the most correct. And so they're not posted yet. We're going to post those, if not later today, in the morning. Yeah, it does suck. But the thing is, that's what it's those types of questions that build again that clinical reasoning and clinical judgment, build those muscles because those are what you're going to need in practice. Um, even like we talk about, the norms and the abnorms and the ranges and all that, it's not black and white in practice. It's rarely is it black and white, just like we say it is. And unfortunately, you have to be able to use what you know and make the best decision with what you have. And these types of things, those questions help you identify it. Because here's the thing that I think, and I'm sure I had the same perspective as a student, as an early career nursing student. We're focused on the questions from the perspective of grading, right? But what you have to recall is that even though these are questions in black and white, the reality is that you'll have to use this content and your decisions will actually affect life. That's what sometimes we forget. And so if you can develop that perspective, and I'm not saying you, Mike, specifically, I'm saying you generically, like if we can remember that we're not just trying to pass the test and being students, that's what we all think we have to write, but this prepares you for it. That's what we're doing. We're preparing you for the NCLEX. And we're preparing you by giving you NCLEX style questions, we're preparing you for NCLEX. And if we did not do that, we would not be giving you the best service. We would not be doing you the best service. It's our responsibility to prepare you for NCLEX because here's the thing. Again, we could give you questions that are like, identify, list the signs and symptoms of gastroesophageal reflux. We could give you those types of questions and you all could pass this test and pass the courses very easily. But when you get to NCLEX, you will not have those types of questions. And then you are at a higher risk for not passing NCLEX because it's not going to ask you which of these are a sign and symptom of NCLEX. It's going to tell you have a client who has, of GERD. It's going to tell you have a client who has GERD and that client is taking omeprazole. Which are the side effects that, which of these would you recognize as an adverse effects of the medication that they're taking?
There might be one or two questions, very few, that would be like, this client has a new diagnosis of this, what type of clinical manifestations would you expect? That's signs and symptoms of such and such, but that's not going to be the majority of the exam.
Mm-hmm.
It's going to be application. No, so what that was, the reflex one is one of the your items for your module 3 learning assignment, but don't screenshot this because it's not finished yet. But with your rubrics, and we might change some of these. So don't take this for granted right this moment. But what I had done was clicked on the reflex one to show it to you. So it's not open yet. for those reasons, it will be soon.
I want to speak to
That was what Ann had a question of what that was.
Okay. Melita is asking, if anyone can't see it, she says, I understand schools are preparing us to be able to succeed on the NCLEX exam. I just don't understand why ATI and NCLEX is teaching us what not to do in the real world. Well, actually, they are. What happens is, so it is preparation for the real world, but what you see or what you will see is that when you get into practice, people make their decisions about what part of what they've learned they're going to implement. And so nurses, all nurses learn the same thing. They may learn it in a different way, but there are standards. And so we all learn the same thing. I don't care what school you're in, what program you're in. It doesn't matter, right? An LPN, and so having taught for, like I said, in the LPN, you guys learn the same content. I could just literally move my content and use it to teach this course or the health and illness. It doesn't matter. It's the same content. What's different is the scope of practice. And so what happens is in practice is not that we haven't taught you what you need to know. Now, granted, we're teaching you the very tip of the iceberg, right? But we're providing you with the foundation. We provide you for entry level practice. Now, when you get into practice, you've got nurses who have made a decision at some point to say, I'm not going to do it the way I was taught. I'm going to find a workaround. Nurses do that all the time. And Ms. Gilbert can attest to that. And then also there are things that will have changed. There shouldn't be a whole lot, but there are healthcare is changing constantly and consistently. And so there are some things that may be different, and there may be some differences in the implementation, but what we are teaching you is the same as, I mean, what the questions that ATI and NCLEX, they're teaching you the standard. That's my point. So they're questioning you on the standard. And so it's not so much not the real world, because I know I've said it, like in the real world we wouldn't do that, but they're teaching you the standard, as in would how things should happen, if that makes sense. I hope that makes sense, because I know you said it makes no sense to you. So I'm trying to explain it in a way. For example, I'm trying to think of something where I said we wouldn't do it in the real world, and I don't know right now. Respirations, right. Thank you, Holly. Yeah, in the real world, now they don't count the respirations, but are they supposed to? Everybody that takes a vital sign has been trained on the correct way. Okay, I'm going to give you an even better example. I've probably everybody in the class has had this experience or have seen it. A nurse is about to either give an injection, check a blood sugar, insert an IV. And what do? They clean the area, and then the first thing they do is start wiping that hand over above it to fan it to make it dry quickly. That is absolutely 100% contradictory to evidence-based practice, because that solution is designed, as it dries, it's designed to kill any microbes on the skin. So if you start fanning it, you're making it dry prior to its design time, and then it's ineffective. Or they rip off, we rip off our, I don't ever do that, but yeah, that's what I was going to say. Pull the finger off the glove and start. Once you clean that area, you are not supposed to touch it anymore, even with your gloved finger. But nurses pull off that tip. They start, all those things. So my point is, it's not.
So clean off a finger like they're doing something. It's like,
yeah,
it's not sterile. Though.
That's not. So you're still exposing your client
I do
to,
it too. I did it for a long time.
you're still exposing your client to infection. So that's my point. It's not that we're not taught the same. And, even though everyone doesn't use ATI questions, we're all taught the same content. It just may be, the teaching may be different. The teaching methodology may be different, but we're all taught the same thing. So my point is that we make our decisions to implement or not to implement once we get out. So that's what we mean by the real world. And I know it's something I said that we don't do it that way either. But
That doesn't mean you're not supposed to.
right.
evidence-based.
Right. Total body surface area is regarding the burns. How do we get on that?
It's in my lecture. I talk about it,
Oh,
but it's abbreviated on the PowerPoint. So if you
okay.
do the PowerPoint with my lecture, you'll understand everything.
I'm trying to see what was. I went to the physical. Jamie says, I think it's important to understand that there is no perfect right. Right. Yes. Yes. And that is the thing. Um, that's a perfect statement, Jamie, because we're preparing you for is entry level. Entry level. So again, what we're teaching you like is the very, very, very tip of the iceberg. You'll get the majority of your education in on the floor, in the hospital, wherever you work. That's where you're going to get your education. Um, but we're providing you a foundation, the expected foundation. Yeah, you learn on the job. Paisley says, school teaches us how to be, you learn how to be a nurse on the job. School teaches us how to be safe and use evidence-based practice. In clinical, we use lecture and class to apply what we know in clinicals, but situations are not always NCLEX perfect, right? There are so many variations, but what NCLEX does is to identify that you are able to recognize problems, you're able to recognize, um, you're able to use foundational truths, if you will, and apply them to your patient care. That's, you know what, Mike, let me tell you this. What you feel like you learn in clinical because you're applying what you learn in class. I guarantee you that what um, you're applying what you have learned in class, and now it feels like you're learning because it's the application of what you learned. Because again, in theory, in class, it's all, again, it's abstract. It's abstract. But in clinical, you can see the application, and that's how you feel like you're learning. We all do. And especially in nursing, you have to, because okay, I can talk to you all day long about how to do a glucose level, how to check a blood sugar. We can do all types of online simulations, but until you actually do it, you feel like you haven't learned, but you have. You've learned the steps. It's now the implementation of that. It becomes solidified. The dots are connected in clinical. Yeah, there's things that you learned in the clinical um, setting. Yeah, so what I was going to say is that it solidifies, it makes it real, right? It's just like, for example, if we all went over to automotive, there's no one in this class who could not sit down and read and understand, or maybe watch a video or listen to a lecture and not understand something about what they're talking about. None of it, well, I won't say none. Some of you all maybe, I know I'm not. I have no automotive knowledge except just I know a car needs oil change. But my point is that we can learn that content. Does that make sense? So it's not a matter of learning, it's the application of it. And that's what clinical provides. And so in the since we don't have clinical like we would want to, well, now you all do. This is where these questions are, especially these interactive case studies. They help with that. Yes. Case studies are very helpful. In the NCLEX seminar that I attended last week, that's one of the things that they emphasized was case studies. Because again, case studies are good for application. I like what Chrissy just said. Chrissy says, I'm more confident that I could be a nurse during clinical than I am in class. And that's the thing. That's why, I know you all have to pass the class. Trust me, I am like an A student. If I make a 99, I just got feedback on an assignment. I made a 90 and I was like, why? What went wrong? So I went to see what she was asking for. So I am very, very grades oriented. Trust me. If I make a 99, I'm looking it up and I want to question what happened. That's just me. So I very much understand the importance of grades. But also is that in this type of program, you can make straight A's and still not be able to apply it in clinical care. You could make straight A's and not be able to apply it. But you have some students who just don't test well for whatever reason. That's their thing. They just don't test well. However, they can take excellent care. They can apply the knowledge to patient care. So your grades, your numerical grades are not a reflection. I tell students this all the time. Your numerical grades in this program are not a reflection of your knowledge or your ability to be a nurse. Now, sometimes as instructors, we're like, okay, that's unsafe. But for the most part, just because you don't make us, 70, that does not necessarily mean that you'll be an unsafe nurse. Okay, let's talk about our content again. Right, there's so many ways to test. And that's one of the things that we were looking at with the overall project. Because, and again, even on the NCLEX, listen, you guys, you won't take this test. They're still working on it, but NCLEX is actually changing. So for the classes, the cohorts that are coming up, they're not going to get the same NCLEX that you are, where you've got, multiple choice questions alone, and then the select all that apply, the drop and drag, all those types of things. They're going to have case studies on the NCLEX. That's what's coming. Um, that's what's being developed right now. That's what the seminar was about on last week. It's called Next Generation NCLEX, and they're going to have case studies, and you're going to have, and the students are going to have to pull information from the case study to answer questions to pass NCLEX. Hammers are very useful. Hurry up and get out. All right. Ms. Gilbert, anything to add? Ms. Gilbert?
I'm good.
Oh, okay. All right. So any questions? I don't want to belabor the time because you guys know I can talk apparently. Are there any questions, any concerns that we can address? Anyone? Okay. Well, you all know if you have questions, please put them in the discussion forum. We will spend the rest of the day working on the exam, reviewing the exam, and hopefully we can give you feedback today or in the morning at the latest, surely. And then we'll have the remaining module content up soon. Okay, Mike. Let's go over anything.
I'm good.
All right. Everyone have a great day. You guys are doing well. Stay focused, stay encouraged.
Miss Gilbert, can you address my question that I sent to you?
What question? I didn't see. Hold on.
Bye, everyone.
Miss Love, did you communicate with Miss Gilbert about the paper?
Oh,
We
that
will.
question, yeah.
Yes.
I was looking for a question in here.
Oh, I just said that. Did Miss Love by y'all? Did Miss Love get in contact with you? It was way up there. Did Miss Love get in contact with you about my paper? What you and I discussed to go over?
Yeah, we discussed it.
Okay, but I didn't get any feedback. Like I got Miss Love's feedback, but I didn't get your feedback.
We discussed it last night, so
Yeah.
it's late. Yes, late last night.
So what should I know?
Well, let's discuss it in just a minute.
Yeah.
It's private, so
Oh, okay. You mean after everybody signs out?
yes.
Okay.
And I stopped recording.
Yes, I was going to say and stop recording. We don't want to discuss your content, your information